So, good evening, everyone, and a very warm welcome to you all to our event tonight on Rethinking Care, how entrepreneurs are innovating health and well-being, hosted by UCL Institute for Global Prosperity's Fast Forward 2030 network. My name is Ville Takala, and I am a lecturer at the UCL IGP. I'm very pleased to see many of our students here today as well. Here are our three master's programs. If you're interested in learn more about them, scan the QR code. A big welcome also to everyone joining us online today. So as I mentioned, today's event is hosted by Fast Forward 2030, which is a global network founded by the IGP to support and connect mission-driven entrepreneurs. Fast Forward 2030 brings together change makers who are not only building ventures for environmental and social good, but who are also helping to rethink the systems that shape our collective futures, from business and policy to research and community engagement. Fast Forward 2030 has 4 chapters established in the UK, Lebanon, Kenya, the UAE, with an ongoing plan to extend to Ukraine in the near future. I highly encourage you to follow the network on LinkedIn and to engage with the network's curated online resources. So today we have an incredible lineup. Firstly, we will hear a reflection on today's theme from IGP's Acting Director, Professor Saffron Woodcraft. After that, we will have an expert panel joined by Ria Yadav, who is Director of Impact and Strategy at WISA. We have Jasmine Cox, Founder and Director of Dreamcatchers Worldwide. And we have Anil Kaul, who is Founder and Chairman of GTW Global. Today's panel will be moderated by IGP student and social entrepreneur Manan Majithia. The panelists will highlight their entrepreneurial journeys and share practical insights into priority areas for improvement. They will also explore how innovation in care can be driven through effective policy, partnerships, and investment. We will make sure to leave plenty of time for a Q&A discussion at the end of the panel. Those of you joining us online, please post your questions in the chat, and perhaps you can also mention where you are joining us from us today. We will conclude the event by 8 p.m. So, without further ado, please join me in welcoming Professor Saffron Woodcraft.
Thank you. Good evening. Thanks very much for having me. So when we talk about care, we often default to a language of systems and services or sectors. Health systems, the adult care sector, social care services, well-being support, and so on. But care at its core is much more fundamental. It's about how we relate to one another when there's vulnerability, whether that's physical, emotional, social, or economic. So care is about who shows up, how and when in these situations, and whether the systems that surround people enable or constrain that act of showing up to care. So today I want to reflect on 3 things. First, how the meaning of care is changing Second, what we're learning from research and practice. And I'll be talking about some of our work at the Institute for Global Prosperity. And then third, what it might take to move us from a fragmented response towards a more person-centric, dignified model of well-being and care. So let me start first then by asking this question, what do we mean by rethinking care? For a long time, care has been narrowly defined. You receive care when you're vulnerable or when something goes wrong, so when you're unwell, aging, or in crisis. But that definition is increasingly insufficient. We're living in a context where well-being is shaped not just by clinical conditions, but by a complex interplay of factors. So mental health, financial stress, social isolation, digital overload, unstable work and environmental challenges. These are not episodic, they're continuous conditions. So our research at IGP on livelihood security, for instance, highlights that the ability to live well is not simply about income, but about stability and resilience. And that security and resilience comes from the infrastructure of resources and assets and networks that support livelihoods and the capacity for people to navigate shocks over time. Similarly, work on economies of belonging shows that social connection and participation and a sense of inclusion are not peripheral. They're central to our well-being. So in this context, care can't be reactive. It has to be preventative and prescriptive, continuous and embedded in our everyday lives. This requires a shift from treating conditions to thinking about supporting well-being, from episodic interventions to longer-term engagement, and from standardized delivery to person-centric design. So importantly, we want to change the question from asking what's the matter with you to what matters to you. And I think this shift sounds very simple, but in practice, it's a deeply structural challenge. So second, I want to share some reflections on what our research is telling us about care and well-being. So at the Institute for Global Prosperity, much of our work has focused on understanding what prosperity actually means in people's everyday lives, and how then we can design systems, whether they're policy systems or the delivery of services, that can better enable people to thrive and flourish. So one of the most important contributions I think the Institute has made in this space is the development of the Citizen Prosperity Index. So the Citizen Prosperity Index goes far beyond traditional measures of prosperity, such as GDP or income. It measures what people themselves value in their everyday lives and what they identify as the determinants of their own prosperity. The index is built on research created through participatory citizen science, delivered by UCL's Citizen Science Academy. So this is another social innovation that's been designed and created by the IGP. The Academy employs and trains people to work as social researchers, as social scientists in their own communities. And they do that by working on defining the research questions and the problems that are of importance to their prosperity, as well as then working with academics to collect data on these topics, and then share those insights and findings with policymakers and entrepreneurs and industry to then think about developing new solutions. Because the index is based on the lived experience of citizens, the Citizen Prosperity Index measures determinants of prosperity. So things like health, relationships, the environment, agency and sense of purpose, as well as material factors like income and housing. So what makes the index particularly relevant to care is that it reframes well-being not as a technical outcome, but as a lived experience, as something that is dynamic and affected by a whole variety of different factors. So alongside the index, which is about rethinking how we understand lived experience and measure pathways to prosperity, we've been doing work on universal basic services, UBS. So UBS reinforces the idea that care isn't a residual function, but it's a foundational part of social infrastructure. Ensuring access, universal access, to essential services like healthcare, education, housing, and care is a foundation for well-being. So the key insight here is that care can't be treated as a residual service, something that is added on when markets fail or when communities fail or families are struggling. It's a core component of our social infrastructure. These experiments expose, I think, a key gap in current care systems. Many systems are designed around institutional priorities, like efficiency, throughput, cost control. If you work with the NHS of the UK, you will understand that that is particularly high priority at the moment. But the outcomes that matter most to people, such as dignity or autonomy, agency, and connection, these remain under-measured and under-prioritized. So the Citizen Prosperity Index in this context allows us to understand care, not just in terms of service delivery, but in terms of how it contributes to a person's overall ability to live well. Similarly, research on social protection for the 21st century argues that existing welfare systems are often too narrow, too conditional, and too slow to respond to emerging risks, whether that's precarious work, or mental health challenges, or demographic changes. These insights, though, are rarely integrated into policy or service design in a meaningful way. So this creates a disconnect between lived experiences and institutional responses. So all this demonstrates, I think, that prosperity and well-being are multidimensional, relational, and context-specific, and yet many of our systems are designed around simplified, siloed, standardized categories that fail to capture the complexity, or fail to capture this complexity, but also the intersections between different areas of our lives. So despite the best intentions of many actors, current care systems are not designed for this reality. They're fragmented. Health, social care, community services often operate in silos, but for an individual, navigating this can be confusing and at times overwhelming, and often bears very little relation to people's everyday experiences. These services and institutions are also capacity constrained, uneven. In many contexts, there are simply not enough trained professionals, or not enough time, not enough resources to meet the growing demand. Access to quality care is still heavily shaped by geography, by income, gender, and social context. And those who need care are often the people who are least able to access it consistently. And I think the final point here is that these services and systems are not person-centric, or not always person-centric. Systems tend to optimize for efficiency and compliance, numbers of consultations, numbers of trainings, rather than lived outcomes like dignity, autonomy, and quality of life. So we're dealing here with a fundamental mismatch. On one hand, we're dealing with deeply human, complex and evolving needs. On the other, we're relying on systems that are rigid and standardized and slow to adapt. So the third kind of key point that I want to make then is about the role of innovation and entrepreneurship. So this is where we're starting to see an important shift. Across different contexts, we've got entrepreneurs and organizations stepping in, not just to fill gaps, but to fundamentally rethink how care is designed and delivered. Some are leveraging technology to expand access, particularly in mental health or remote care. Others are building community-based models that prioritize trust, proximity, and cultural relevance. And some are thinking workforce models and pipelines, so training and supporting and elevating caregivers as central actors in the system. while others are experimenting with more holistic approaches, like integrating physical and emotional and social well-being into a single continuum of care. But innovation at the organizational level is only one part of the picture. I think the deeper challenge is one of system change. Because many of the constraints we see in care, like fragmentation and underfunding and workforce pressures, are not failures of individual organizations, they're failures of how the system itself is designed. Systems change in this context then means to keep the individual at the core. So to move from short-term outputs to thinking about long-term well-being outcomes, from working in silos to integration, and from top-down decision-making to more participatory, citizen-informed, person-centric design. And I think critically to move from treating care as a burden to treating it as a social infrastructure and a social investment. So the question then is not just what works, but what conditions allow what works to scale and sustain and influence the broader system. This is where we've demonstrated that initiatives like the Citizen Prosperity Index and the Citizen Science Academy become important parts of that infrastructure, of that ecosystem, providing a new kind of framework for understanding well-being and understanding and enabling communities to actively generate their own knowledge and identify their own problems, priorities, and contribute to shaping solutions. So what do we mean by person-centric care? What does it actually require? Person-centric has become a widely used term, but I think it's worth unpacking what it implies. And I think at a minimum, it requires 3 shifts. So the first is agency. Individuals are not passive recipients of care, they're active participants. So this means we need to be designing systems that allow for choice, voice, and co-creation. Second is continuity. So care is not episodic or disjointed. It needs to follow individuals across their life stages and across different needs, regardless of gender and background. Third is context sensitivity. Well-being is not universal in how it's experienced or in how it's expressed. It's shaped by culture, community, gender, socioeconomic realities. So person-centric care needs to reflect this diversity. And these are not easy shifts. They require us to rethink incentives, build dynamic capabilities, redesign routines, and in some cases, think about redistributing power within systems. So no single organization, no matter how innovative they are, can transform the care ecosystem alone. So scale, particularly in care, is deeply tied to collaboration. Governments bring reach and legitimacy. Non-profits bring trust and community connection. The private sector actors bring innovation and efficiency. And communities themselves bring knowledge and lived experience and accountability. So the question, I think, is not whether partnerships are needed, but how they're structured. What do they focus on? Do they focus on being transactional or long-term? Do they align incentives across actors, or do they allow for flexibility and learning? I think getting this right is essential if we want to move from fragmented efforts to a more system-level impact. So just before I close, a note on the care workforce. I think any conversation about care must also acknowledge the people who deliver it. So care work is often undervalued, underpaid, gendered, and invisible, yet it's foundational to the functioning of our societies. If we're serious about transforming care, then we need to invest in the workforce through training, career paths, fair compensation, and social recognition, because ultimately it's not systems that deliver care, it's people. So if there's one idea that I'd like to leave you with, it's this. Transforming care is not about a single breakthrough innovation. It's about consistently aligning systems, incentives, and practices around the real needs of real people. It requires compassion to recognize what is not working, It requires courage to test new approaches, and it requires collaboration to scale what does work. And I think most importantly, it requires us to keep returning to a simple question. And that is, are we enabling people not just to survive, but to thrive and to live well with dignity, autonomy, and support? And if the answer is not yet, then obviously there is still work to be done. So thank you for listening. And I'm really excited to hear about how today's panelists are innovating for health and well-being. Thank you.
Thank you so much, Wille, for the kind introductions, and thank you so much, Saffron, for such a thought-provoking reflection. I think if I was to sum that up, one thing that I would probably remember is that it's more than what you are asking people about what's wrong. It's actually about what matters to them. And initiatives such as the Citizen Science Academy, the Citizen Prosperity Index, are great initiatives that have come out of the IGP, which I would personally love to probably see it getting scaled all across. And coming back to the panel, firstly, a very warm welcome. Thank you so much for sparing the time to come here, and we are very excited to listen to your stories, to your journeys. Before I begin with the first question, just a quick question to the audience. How many of you are from the healthcare sector? Okay, that's wonderful. And have any one of you ever worked with the NHS or with any government organization? Okay, that's amazing. So it just helps us set the context because, if the audience comes from that sector, then a lot of our journeys and the reflections will probably resonate personally. I want to talk about, before we get into the nitty-gritties, about this word transformation. And since the theme is transforming the care ecosystem, I feel that transformation is a buzzword nowadays, which is being thrown around in academic circles, in white papers, of course in the marketing and the media ecosystem. So if I was to ask each of you your understanding and definition of transformation in just one line, what would that be?
For me, I think it's about being physically and mentally fit enough and relevant to the society that we're in, because if you're not physically and mentally fit enough and well enough to actually contribute and be active, you're not relevant. So transformation, if it can help individuals achieve that, and that's a personal statement from me, I mean, that's how I feel about it. Ultimately, that's if we can do that at scale, we achieve something.
That's right.
Yeah, I think I'm going to echo what Saffron was saying. I think it's not so much about transformation, but it's kind of going back to it being person-centric. And we've moved so far away from that. There's too much focus on systems and not actually addressing the problem, especially where it's being delivered at a grassroots level. So I think it's about really shining a light on the connection between the delivery and the service user or the beneficiary. That element is getting really diluted. So you start with these amazing ideas and these budgets and these programs, and then by the time it's actually delivered to the person, it doesn't look anything like how it did in the boardroom or in the where the projects are put together. So I think it's coming back to that person-centric focus.
Ria.
Agree with everything. I think what I'll add is, in the context of healthcare and well-being particularly, I think of transformation as a state of the world where there is a vocabulary that is innate in people, and then they ask for what they want, as opposed to us trying to solve for solutions and giving it to people because of what we think they want. So I think that's the transformative world that I envision, is that innateness of demanding for care and seeking that in each individual's own contextual vocabulary. I think that would be a transformative world.
Thank you. No, that also helps me build upon more about your idea of transformation. And for a minute, let me also take you back to that point when you decided to begin your enterprises or lead global ones. How and what was the main problem that you set out to solve? And how did this definition of transformation that you just explained so beautifully, how did you use that definition to shape the strategy from day one?
Do you want to?
Happy to, yeah. Very quickly in one line, I think so. WISA is the name of the organization where I lead our impact work, largely based in India, but strongly resonant across. At its core, WISA essentially offers mental health care and well-being to people through AI-enabled chatbot solution. And it's been around for the last 10 years, much before LLMs and ChatGPT were very mainstream. And the need is very clear, which is in the absence of any other avenue for support. At 4 a.m. in the night when there is no therapist, there is no access to friends or family, there is no one. If someone has a panic attack, which is, I'm sure at least half of the room here has had experiences with those feelings, where do you go to? And that's the problem that we solve for by building a chatbot that stays in your phone, in your pocket, 24/7, that could give you the same kind of care an actual human therapist would. Now, linking it to the transformative answer and that world earlier is a lot of care, and I'll speak specific to mental health care since that's the work that I do. A lot of the demand and desire for mental health care comes from a felt need or a gap. You feel anxiety, you want help. You feel stress, you want help. And that's wonderful, and that's definitely something that needs to be taken care of. But there is a much larger ongoing sea of layer underneath that, which is of resilience that's compounded and built over time, which is the innate ability of the human resolve to be able to grapple with the stresses of life. And I think that for me is the transformative layer, is that any intervention or any work that needs to be designed, that's where we focus on, which is can you build that skill set almost and think of mental health not just as a medical problem, but as a skilling challenge, and build that innately in people so that more and more people, A, start asking for the right kind of help, but also they actually have something to resort to in the absence of everything else.
Thanks. Jasmine?
I guess for me, it wasn't, that was beautifully said. For me, and it didn't come as naturally as that. As my own personal experiences, I would notice things, I'd kind of log it in my brain and go, I hope to make a difference one day. I don't know how I'm going to do it, but that doesn't seem fair. That seems unjust. And I kind of collected all these stories and went through my own experiences, and I was like, how am I going to, affect change? In another life, I'm a professional choreographer and dancer, and sometimes to get through to certain communities or underserved or vulnerable communities, it's not always the way you think it will, the gateway that you think it will be. And for me, it actually was dance that I started with one of my first programs. It was a community service program, and it was a dance class, and it was free for those who wanted to take part, so money wasn't a barrier for talent. And from there, that was the first service. And through collaborative workshops and listening to families and children and schools and other organizations and charities, we, again, as Saffron said, everything she was saying was like, yes. We don't create the ideas. We listen to what people need and what they want. And then we create those programs based on the information they're giving us and not the other way around. And I think what gets lost is with organizations, especially the bigger they get, they become so far removed from the problem and so far removed from the people they're serving that they lose that. And even recently, we've started doing these very simple things now in all the programs that we do, which is just one simple question. And old school, I'm a teacher as well, so post-it notes, very easy, pen and post-it note, always the way to go. And just getting, asking a simple question to whatever target audience you're serving that day or that project or event. And you ask a simple question like, what is it that you need? What is it that you'd like to see? What is the change that you'd like to see in your community? And when you start with that, such a kind of inviting question like that, you get such valuable data. And from that data, with the right team, of course, you are able to then curate and create the services that they need. And so for me, it wasn't a traditional way how I was like, okay, I'm going to solve this problem and I'm going to do X, Y, Z. I used my own talents, and I was very fortunate to be able to access that. And I wanted other people to access it too. And so that was kind of the gateway. And then from there, we were able to create, a range of services and then partnerships, which I'm sure we'll talk about later, and as well as, have a not-for-profit kind of element and the entrepreneurial for-profit element too, which is also very important. They have to work in collaborative nature to solve the problems that we have to solve.
That's amazing. Thanks for sharing that. Anil, any thoughts?
Yeah, I mean, I've already learnt so much from Ria and Jasmine in the last couple of minutes from what they said. It's quite remarkable. Yes, sorry. Can you hear me without the mic at the back?
It's actually being recorded.
Okay, sorry. Okay. So I just said I've learnt so much in the last few minutes from Ria and Jasmine. I don't come from the care sector. I don't come from the healthcare sector. I come from technology and consulting. And that's the background. Why are we in this sector? Why have we decided to get involved? I think is a good question. So I'd like to try and answer that as quickly as possible. Some of it's personal. So I think over the last, most things are, I think, ultimately, if they matter to people, then they matter. And so the simple answer is we care. And we care because firsthand, one sees what happens as people's cognitive abilities, their mobility capabilities, etc., decline. And when you see that, and when you see how we as societies and as agencies, as companies try and provide some relief to that and some meaningful solutions, there are so many holes in the process. So that's the first thing I think my co-founder and I started to notice a couple of years ago when we had this conversation. And then we did some research and we realized that the problem, if you like, or the challenge is truly global. It's everywhere in the world. Yeah. The differences are at what speed populations are aging, what the social care budgets are like, and what legislation exists, what's the cultural acceptance to different types of caregivers, et cetera, and it comes straight back to the point that the Professor made, which is very much about nobody's got a monopoly on this knowledge to actually address this whole system. Yeah. And it is something where partnerships are absolutely vital. There is no other way. One needs a range of skills. One does need money. First and foremost, there has to be adequate funding, training and skills education that is relevant to today's needs and future needs, and that requires hybrid models of skills development. Traditional models don't work that well. Cultural transformation is very key. If you take people from one culture and transplant them into another culture, let me give you an example. Ria will be familiar with this. If you take people from, say, the Philippines or India, and they are registered nurses, they're fully qualified, and you transport them to Germany, and they land in Berlin, well, the first thing is they're in shock. The Germans around them, sorry, I love Germans, but, the sausages, frankfurters, potato salad, so the diet's an issue. The language is a huge challenge. Yeah. The work practices are different. The way public policy runs is different. Recognition of their qualifications is different. Yeah. They have to go through a bridge program because that's how it works. So anyway, that's just one example. The other issue that we noticed was the scale or the differential between demand and supply. To give you one number, I hate numbers, in the EU alone, excluding the UK, there's a requirement for about 1.2 million registered nurses just over the next decade or so. These numbers are not going to be met easily. Okay, so partnerships, again, are vital. Why we got involved is because we recognized, A, the commercial opportunity. I'll be very open and honest about that. And unless we succeed commercially, we're not going to be able to do all the other things. The other thing was because we cared. We saw what's happening. We feel we'll need care one of these days, and we'd like to choose our own carers. Number three, we felt that the whole thing is systemic. it is very much systemic and fragmented, hugely fragmented. So to address that, and nobody can address it on their own, what we tried to do is form partnerships across markets, across different markets. And those partnerships embody sector skills, i.e. care and healthcare, consulting skills, because usually transformation is required in technology and work practices, finance, legal, and compassion, most of all. So I'd like to end by saying that, you know, if we move away from being obsessed with problems and become obsessed with solutions, that would be a very good first step.
Thank you.
Let me stop there.
And I guess a lot of the scale that you spoke about maybe comes from that itself, since the definition that you explained was well-being at scale. And I think what I'm picking up from the three of you is a coherent theme around making it personalized and not standardized. Of course, there's a lot of talk about that all of you did around the skill set piece of it, and not just keeping it a very demand-driven kind of a thing, but to actually equip, whether it is personalized services or it is through at scale, there is that touch coming in. And I think the last part, which I kind of found common in the three of you, was that all three of you are kind of very invested in this piece. It could be because maybe it comes out of some personal incident or some personal reason, but I think that bit is very important, because you have to care for something to be able to invest yourself in a sector that's not like the poster child of social enterprises. So I can vouch for that. And I'm glad that we spoke about person-centric, because my next question, and this is Ria for you, you know, we are aware that Vyasa looks at AI and mental health. That's predominantly what the work is around. And it's delivered in a very person-centric approach, where the person who's receiving the care, the services, is at the core of everything that's around it. You know, now as the Director of Strategy and Impact, and you've also worked with the Gates Foundation, with the USAID, how do you evaluate the effectiveness of this model? And also some limitations when it comes to behavioral adaptation, you know, for better outcomes.
Yeah. It is a pretty tough question, because ultimately I think no matter what field or problem anyone is solving for, you have to look yourself in the mirror and ask, does this work? Is it making an impact? Is it actually creating some net positive benefit? I think the largest challenge in anything to do with care, healthcare, mental health care, is just that the follow-through line of seeing that impact is inherently longitudinal and very long-term. So much of the work is at a very short-term output level, and there are a lot of metrics that can give you confidence to be like, is it reaching enough people? Are there KPIs and metrics you're tracking? Is there completion rates, utilization, NPS scores? You know, there's a lot you can do to make sure the process is in the right direction. But inherently, in something especially like mental health care, we work a lot with adolescent girls, for instance, in rural India now. And the theory of change says that, you know, if you teach adolescent girls negotiation skills really early on in life, in their adolescence, in their adult life, they're much less likely to face intimate partner violence, for instance. Now, that longitudinal chain and that entire theory of change is really hard to track. And therefore, so that I think is the largest problem, is in the absence of being able to see that follow through often, what do you look for? What are the proxies that still work out? For us in our work, it's been two things. One is that at its simplest level, if we ask ourselves, you know, let's say we go shopping and you buy a dress for yourself. If someone were to ask you, was it a successful shopping trip? What would be the metric? You would essentially ask yourself, like, do I like the dress that I bought? Am I happy?
Worthy for money, maybe?
Yeah. But it's such a subjective, self-reported metric, right? Ultimately, there is no questionnaire, there is no scale.
Absolutely.
Did you think you bought the dress you wanted to buy and you're happy? And so that's one of the metrics we track now in our work is, you know, and Vyasa today operates at a pretty large scale of 7 million users across 95 countries. So it's been operating at scale over the last 10 years. And we always consistently ask people, was this helpful to you? it's a very simple question, and it is meant to be subjective, because whatever you thought you wanted to get out of by engaging with this digital solution, did you find it helpful? So sometimes simplicity can help by really breaking down all questions and scales. And the second thing we do is we also try to measure things that can't be measured. And that's the work that's interesting. And I think I've been reading and doing a lot of research on that front, which is particularly in contexts of underserved communities. And I think, I'm sure, Jasmine, you'll have a lot more to say on this, is how do you measure something like joy? How do you measure something like self-efficacy, agency? There are scales, there are metrics. The smartest researchers in the world have tried to capture that numerically. But how do you capture joy? And so I think that's the second piece where I don't have an answer, but I do think it's worth us and people figuring out, because those are things worth capturing, and just because you can't measure them doesn't mean you shouldn't.
And very rightly said. I think that's a output over an outcome debate. I think it goes hand in hand with every social enterprise. You touched upon the limitations. Effectiveness, we all understand technology. You can reach 7 million girls, absolutely. Is there any other added advantage of having a technology aspect to it?
100%. One of the most crucial things technology does, and of course I think I don't have to belabor the point of all the risks that technology now brings. And there's no world in which technology should replace therapists. It's all about complementing, it's about partnership, collaborating, and reaching places human beings can't. Having said that, I think the biggest benefit of technology we've seen is that it absolutely enables a non-judgmental space in a way that no human being possibly could. And so when you speak to a robot on your chatbot and text, the speed with which you open up and share your deepest, darkest thoughts and secrets is 3 times faster than what you would with a human mental health professional. And just that by itself, I think, is speaking testament to the fact that technology can give you anonymity, it can give you non-judgmental spaces. And sometimes in therapeutic work, that's actually the most important thing that can make or break whether someone has a breakthrough and a reframe in their mind or not. So I think that's something inherently human beings can't. But of course, on the flip side, there's a lot technology still can't do. So I'm a huge fan of hybrid models.
Yeah, so I think what I'm hearing is that technology helps you scale and helps people open up, but you're still not there where you know whether that opening up is making a dent somewhere inside the person. That makes me come to you, Anil. GTW Global, you've spoken some part about it. From whatever you've explained, GTW Global takes a systems lens to workforce development, capacity building, which in itself is a very difficult area to be in. And I can vouch for that. I've been in that space. So absolutely. I'm just wondering, somebody like you who comes with such experience of working across so many different geographies, now getting into this sector, how are you thinking about program design or delivery, looking at the massive expanse of geographies which comes with its own complex network of policies, standards, certifications, laws, do's and don'ts? What goes into designing something which is relevant across so that your workforce is professional, they're skilled, and best of all, they stay in that sector?
Yeah, that's a very relevant question, and one we've given quite a lot of thought to. I think the first thing is you need to start with the 3 or 4 components or 3 or 4 sets of people that really are vital. So there's the people who have the need, i.e. those who require care. There are the people who deliver it, let's call them professionals, skilled professionals. Both of those sets of people have to be put very high up in your priority list.
Absolutely.
In terms of looking after them, caring for them, making sure that they get the respect they deserve, but also for the actual carers who may be transcending cultural barriers and actually moving continents because they're driven by a desire to improve their lives and the lives of their families. What they also need is they need support and guidance throughout their career. which actually means staying with them for the journey and actually helping them achieve progress. And that could be a course in public policy or a course in public health. So what they're doing then is you take the case of the nurse from Kerala or the nurse from Philippines or whatever, landing in Berlin or Hanover or wherever, or London or Liverpool. They need to become capable of navigating their way through the society they're in and contributing to it more deeply. They can only do that if they increase their knowledge and their capability. So one of our key focuses is to stay with them and to help them develop those skills and support them in doing that. This brings me back to the technology point. I think technology has one other key deliverable. What it does is, in a very fragmented and exploitative system, because that's what workforce mobility is, we are not just about workforce mobility. Technology removes that. First of all, it acts as a balancer between supply and demand. So partners, governments, compliance agencies, candidates, all of these people in the ecosystem can actually use a technology platform, if it's designed properly, which is exactly what we're doing, to remove the exploitation that occurs. So candidates actually don't pay any fees to people like GTW Global, do not charge any fees. We charge for training. We do not charge candidates anything, because what we're trying to do is help them reach where they want to go in life. And we want them to be best able to do that and be workplace ready, which then involves, a bit of psychometric testing, a bit of cultural integration, a bit of crisis management, a range of skills. The other side of it is, do you have partners in the countries which you're looking to serve? And that would include the UK when the UK government gets its act together, hopefully sooner rather than later. Sorry for being so blunt. The partnerships that we seek to build must embody a range of skills so that we can have conversations with governments, try and change public policy. Let me give you an example. In some countries, by law, the ratio of qualified nurses to nursing assistants is set by law. In Germany, it's set. That has to change. So we need to have discussions with the German government and lobby for those changes so that they can meet their own needs. Because if they don't do those changes, that's just one of hundreds of examples. If they don't make those changes, they will not meet their needs. There are many other issues and challenges out there. But to answer your question, just to finish off on that, I think we're approaching it from the point of view of the key stakeholders in the system and looking after them, but also using technology to take away the negative aspects of what currently happens in workforce mobility. Hopefully that.
No, that does. I would have probably loved to double click on the government piece, but just keeping the time in mind, I want to build on the stakeholder piece because I know Jasmine works. She's one of the only ones who works at both ends of the spectrum, children and elders. You founded Dreamcatchers Worldwide in New Zealand. Usually people start up something in London, then move to New Zealand. You probably did the other way around. You're now scaling operations here, and so much of your work, I heard, obviously compassion, accessibility is a huge part of it. The question I wanted to kind of ask you was, these terms, and Ria touched upon that as well, that how do you measure joy? So compassion, accessibility, social, emotional, mental health, these are terms which look good on paper. But when it comes to working with the community, that also underserved communities, how do these concepts translate into service design? I mean, what exactly do you have to do to get a compassionate delivery done?
Nice, easy question for me there. So I think we can't fix all the problems. And as you said before, there's no monopoly. And so working with experts and other organizations, especially ones that specialize in certain areas, will help you strengthen your own delivery. We don't have any therapists, for example. We don't have any psychiatrists. We don't have any psychologists. So we wouldn't be assessing things that we are not qualified or capable of doing.
Yeah.
However, we do fill in the gaps, and that's what a lot of organizations do. Not-for-profits, social enterprise, we fill in gaps that our government perhaps should be doing, or our taxes should be paying for. However, if they fall short, the people are creating businesses and setting up organizations because they're seeing injustice and they're seeing things that we don't believe are right, and so we are taking it into our own hands. However, we can't solve all the problems. So one thing that I always focus on is collaboration. So it's also a thing about when you do step into new spaces, new communities, people are naturally defensive. People have spent years, time, effort, building relationships. And at the heart of all of this, it is all about relationships. And that trust that not-for-profit organizations and charities spend majority of their time doing, or should be, that is so valuable. But at the same time, like any entrepreneurial business or anything else, they have their own value as well. So without collaboration, you won't be able to assess joy or happiness, or whether you feel a good sense of dignity and autonomy and agency in what you're doing and living your day-to-day life. One of the programs we have is something called Smart Tech for Seniors, and I created that program in New Zealand in 2016 because I was trying to talk to my dad on the phone using a video call, and he was just effing and blinding because he didn't know that he was on mute. And I'm like, and he's like, and my dad's 77 now, Irish, English, working class, proudly working class. And it broke my heart. You know, I'm on the other side of the world. I'm in New Zealand. He's in South London. And we can't have a conversation, all this amazing technology. And yet without the knowledge and the care and the support and the guidance for our vulnerable people, they can't access it. So as fancy as it all sounds, if people can't access it, it doesn't matter. So, yeah. I said, well, if my dad feels this way, I'm sure there's another 100 people of my age group who are trying to talk to their parents. Or, I'm sure this has happened to all of us, your dad, your uncle, your granddad. Oh, can you just do this for me, please? Can you just, how do I add that picture? Or how do I, you know, we've all been there. And so we just set up a free program. And no, it was very innovative. We talked about innovation and transformation earlier on. No one was doing that in 2014, 2012, because can you make money from elderly people? Not really. And so it's that collaboration where you have to look at things in a business way because you need the money and the investment in order for things to be sustainable and to scale, but you also need the not-for-profit grassroots expertise on the ground to access and to deliver and work with others to assess the joy, to assess whether any progress is being made. And so, yeah, I'm very happy to say that we're still running that program, and we've set it up here in London. We're running out of 2 venues at the moment, and we're hoping as well, if there's anyone here that wants to invest or sponsor, we're looking to work with banks because one of the biggest problems here in the UK is scams and fraud, and I'm sure you know someone, or you might be affected yourself, of fraud or scam, or someone's won £1 million or send me this money. There was something on the news the other day, and a lot of vulnerable people, elderly people, are targeted, and they are the people who are least supported. So you're going into banks, and there's no one here to really have the half an hour of time to sit down and go, this is how you do it, which is why they come to us, and we help them because we have trained experts who are the most important thing. I always say it's not content, it's empathy, it's patience, it's being personable, it's being likable, it's being clear. And I always say, after that, you can be trained. You can show, this is where Facebook is. This is how you download an app. This is how you, one day, experience how to use a chatbot or, AI. That's further down the learning materials for our seniors. But, I guess, in short, that was the long version. But how do you assess joy? I think it's always about collaborative working with people who are experts in their field, but also trusting people who are delivering the services as well. I love that you mentioned the Philippines, because I'm half Filipino. A lot of people don't realize that. I'm a bit lighter. But one thing that as well, I just wanted to add to what you were saying. When people come to this country, my mum came from the Philippines, I'm sure people from different migrant and mixed backgrounds, there's so much pressure to integrate into the amazing city of London or England. But what we lose a lot is the value that they bring. Instead of focusing so much on, we need to bring you up to speed with the way it's done in the UK, and I really credit, I did my master's, and we looked at indigenous pedagogies and really valuing how we look at things from a decolonized perspective, is valuing a lot of the amazingness that comes from people who are the nurses, who are the carers, who are the mental health support workers, youth workers from different countries who have different ways of looking at it. And if we valued that and celebrated that a little bit more, I think we would probably move a bit quicker in the right direction as well. So I just wanted to add that little piece there as well. No, shout out to the migrant families there.
And I think that's a conversation for another day. How to get governments in the room to talk about that piece, And I would probably love to be a part of that conversation where, say, a UK government is being asked to do something that the Scandinavian countries are already doing, and the Global South is more than happy to, copy paste it in their geographies. But yeah, I think you definitely have my mum coming in for the Smart Tech for Seniors.
Everyone's welcome.
No, I think a couple of weeks back, she reached out to me asking, how do I make a reel? I was like, please, nobody's going to ask you. Nobody's going to see your reel. But no, jokes apart, and I think we are almost out of time. So, before we open up the panel to some of the questions that the audience wants to ask the panelists, I think I just want to end on this note. We started out with transformation. All of you have explained your own definitions about it, how your solutions were shaped by it. So much of your day-to-day work is revolutionary because it's a space very unlike to other spaces, where there's so much of real interaction. So if we were to gather in this room 10 years from now, what would actual transformation look like from where you are currently?
Okay, I'll go. I think there would just be a more, so I'm going to try and answer it as shortly as possible, but some people with great ideas, great teams, great organizations have to go through certain barriers in order to make their projects and their services come alive. And one of those, for example, is working with community venues. Now, these community venues are usually owned or funded by private business, and that's great. However, and I said this, and this is one of the things that one of my businesses, JC Console Group, this is what we try to fix this problem, is when you're dealing with community members, that's where the passion, the empathy, that kind of informality can play out. But when you're dealing with community venues, businesses, that needs to be run as in the normal corporate way that you should expect, high expectations. And what happens, unfortunately, and I'm seeing this, I've seen it for the last 12 years, the communication between the not-for-profit organization or the charity and the business that holds kind of the power of the venue and the facilities and the time and the space, that's really broken. I think one week I was calling a venue and all the numbers on the website were dead. They all went into La La Land, all the voicemails, they never called you back. There was no one responding to emails. And these are people who are multi-million pound funded, who have their tight grasp on the spaces, the limited spaces that communities can run their programs out of. And so, to answer your question, if I was to say in 10 years, what would transformation look like? I think one very easy way is to train both sides. It's not just the people coming into the country and the not-for-profits and the grassroots organizations, but it's also the big business and the corporate companies who don't always understand this side of it, the grassroots service user. And so it's that little jigsaw piece in between. If people could communicate and understand each other a little bit better, as well as smoother communication, better systems and processes, blah, 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 then the end goal of delivering the service would be more effective and efficient. So yeah, everyone can speak together and be harmonious. That's what I'd like to see.
Yeah, thanks, Ria.
What would transformation look like in 10 years?
Absolutely.
I think I'll dream a little bit smaller than Jasmine's thing. It would look like a world where we're no longer shoving designs down people's throats, and really making sure that at least in 10 years' time, we rule out and phase out the word underserved, because no one should remain underserved. We should have made enough leaps using technology and all of the other models to make sure everyone is adequately served.
Yeah.
But what that service looks like needs to come from bottom up. It has to be like all the things that Saffron spoke about as well, person-centric, co-created, their voice, their design. And that's also where most of the innovation already rests.
Yeah.
I think folks in rooms like these don't see it yet, but hopefully in 10 years, that's more at the forefront.
Thank you. Thank you. Anil, any thoughts?
I think the quick answer is we actually don't know what it looks like to some extent. Sorry, the answer is we don't actually know what transformation might look like in 10 years' time. We're at a crossroads right now. That's why I say we don't know. We're at a crossroads in terms of geopolitics, and that is impacting everything. If we take the recent example of just closing a particular waterway, if you have the material or the skills that you want to supply, you also need the pathway to actually get it to where it's needed. So when we talk about care, if you have lots of skilled resources, and by the way, there's a global imbalance in where those resources come from and where they're needed, there's a complete global imbalance. It's not going to get fixed in 10 years, in my view. It might get fixed in, we may go some way towards fixing it in 2 or 3 decades, perhaps. Yeah. But as I said, it's very important. The Straits of Hormuz illustrate one thing very clearly. You need the skills, you need the talent, you need the oil, whatever it is, the material, you need the pathways, you need the transport mechanism, and you then need to get that set of that package of whatever it is that's needed in the care sector, and that's quite complex, to where it's most needed, and then you need the skills at that end to deliver it effectively. And all the time, you've got to be looking after everyone involved in that whole ecosystem, end to end. If transformation in 10 years, can it achieve that? I personally don't think so. I'd like to be very positive. We'll work towards that. But I think we can go a long way towards that if we look after all the stakeholders properly and if we're empathetic about people. In the end, it's about people. Yeah. It's about you, me, and everyone else. It's not about robots and AI agents. I wouldn't like to see robots looking after people. We've tried that in some places. It does not work. People reject that. Yeah. We need human beings to do that. Properly trained, properly equipped, technology supported, technology enabled, but we still need people.
Right. No, that's very interesting. And I obviously joke to a lot of people that care sector is the only sector which is not going to take away our jobs. So if you know a lot of people who are out there looking for jobs, help them to become care workers. Their jobs are guaranteed. And I completely resonate with that. I think another piece which I've picked up from the three of you right now is also if the decision makers, whoever they are, need to come down, need to speak to people, and not just during elections, not just during a certain time when they actually need them. And I think, Ria, we resonate with that because from a social perspective, Jasmine, it's difficult to get investors to come out of their offices, fancy corporate offices, come down to the field and actually talk to the users who are actually going to be benefited from those services. So thank you so much, panel. I hope you were able to share your journeys, and this was as rewarding as it is for all of us, as it is for you. So thank you so much. You've been a lovely panel. We'd like to open this up to the questions.
Thank you. Lots to unpack. Jasmine, you said you can't make money from old people, or it was something like that. My wonder is why, and is it due to a lack of understanding their needs? And for all three of you, and this might feed onto it, who are the key players required in the solutions, and who's missing, or who's not engaging?
Yeah, I don't think you can't make money from old people, but I think when you're dealing with businesses who want to sponsor an event or a program, that's what they're thinking, is how can I make money off of that section of the population. And for us as a not-for-profit grassroots organisation, that's not our incentive. We're not thinking about that being our number one goal, but it is a goal that we have to think about when we're talking about business working alongside not-for-profits. So that's why the conversations need to be had. You know, for example, one of our trustees, she recommended an ethical bank, and she said we can create workshops and promote their app so that it can, older people can learn how to use that app, and so there will still be some kind of buy-in around the promotion of the app and encouraging people to use it online. And it's having these conversations which unpack the needs of the business alongside us wanting to help people and them not feel that they're falling through the gaps. But these are conversations that need to be had. These are meetings, and some people who are short-sighted, perhaps on either end, business, not-for-profit, sometimes don't see the substance or the value in those conversations. So I think there's money to be made everywhere, and of course there is, but it's the collaboration where both sides can kind of tick their check boxes as you know they have to with their forms and things that they need to fill at the end of it. But it's the work to be done in between, and it's that thing that's really hard to outline. It's just the work that needs to be done. But yeah, I do think money can be made from all elements. It's just about aligning yourself as well with the right business. Not every bank you need to work with, not every profitable for-profit business you need to work with. It's about aligning them with the mission and the values that are important to your organization, and hopefully then it will work. What was the second part of your question again?
It was just about in terms of the solutions that are needed, who's missing from the picture, who's not engaging, because then I can make a list and find out how to.
Yeah, I mean, I'll give my quick response. But for me, there's a big disparity between the trustees that sit in the boardroom and sign the policies, create the policies, write the procedures and the processes, and the people that it's actually affecting. It's too big. And because I work on both sides, I can talk to that. Over the last 14 years, I've worked in schools as a teacher, I've worked as a youth worker in youth clubs. You know, I've seen it from every single angle, and obviously being in the boardroom myself. The disparity, the difference, it's too stark, and there needs to be the people in the room, and people need to be reminded of the value. So that's what I was saying as well. The people who are delivering, when we talked about care workers, psychologists, psychiatrists, youth workers, teachers, the rest of it, nurses, they need to be in the room. And it doesn't. And we need the people, the physical, the not the online, because there's an energy, there's a something that's not tangible that you get when you're in the room and you're speaking. You feel things and you learn things, and you share things that can't always be read from a report or a QR code. And so it's the physical presence and value and validation of the people who are doing the work alongside the people who are funding the work too, and getting that middle ground. So yeah, that's how I would say it.
I'd like to add one thing to that. I agree with everything you said.
That's good.
I think it's absolutely spot on.
No,
for what it's worth. But I mean, one element that I think is missing that's pretty key, because if we do everything else and get all these business people on board as well, you know, the ones we're talking about, the one element that's still missing is government. That's fairly key, because if government don't put policies in place that allow skilled people to come into countries and deliver the services that are needed where there's a huge mismatch in terms of numbers required, then we can do everything else, but I'm afraid the solution isn't going to happen. So examples of countries where the governments have taken actually quite an enlightened view, Germany is one of them, Australia is another, New Zealand is another. Both Australia and New Zealand have done it very recently, but they've actually passed laws to enable some of their elderly care needs to be met by fast-tracking entry. The fast track, by the way, is still very slow, just to be realistic, okay? Germany passed laws through the Bundestag in 2024, June, and then they did further changes at the end of that year. Very pragmatic, everything's in the public domain, it's on the federal government website, and it's not just about care for them. There are about 180 classifications of skills where they need people in order to keep the Mittelstand, or the middle economy of Germany, going, which is a powerhouse, and their economy is suffering. So certain countries are taking a lead. I care a great deal about the UK because I've spent much of my life here and paid a lot of tax here as well. So I'd like to see some of that money applied in the right way. So I hope people are listening. I would like to see the various political parties work far more collaboratively for this area, because they have a tendency to kick the problem down the line. And I think we can all play a part in putting together, or have a process of putting together, some sort of paper over the next 6 months or so, which we should present to the health secretary and other stakeholders. And I'm sure all the other organizations, Royal College of Nursing, people are involved in social care, people are involved in mental health issues. All of us would like that. We'd like to see some sort of action program that is putting some effective pressure to make things happen. So that would be my little suggestion.
I'll do a quick shout out to Looking for Growth, who I'm nothing to do with, but they're a political do tank, not a think tank, and so they might play a part in the solution.
Absolutely.
Thank you.
Welcome.
Probably have just one more question.
Hello, thank you for the talk. It was very nice to listen. So my question was about, I think a central theme that came across was personalizing care. And I wanted to ask, how do you guys see this actually happening in action? Because I think it's easy to talk about, but actually doing it is the difficult part. And I think like the simplest example I can think of is Visa in India would have to have multiple languages just to reach different states in India. And an adolescent girl in North India would have a completely different context from an adolescent girl in South India. And when there's so many different contexts, so many different cultures, and each person comes with their own story, how do you make a service or a platform personalized to each and every one? Or if not personalized, at least inclusive of as many stories as possible?
Thanks for the question. It's the most burning question, right? And I think that's the right theme. I will say that if there is a time in the world where it's possible, it's now. Just given how much AI and LLMs have unlocked in terms of ability to personalize. And you're spot on. So when we brought like the English Visa chatbot to India, we now have it in like almost 10 Indic languages and many other European languages. But the first language, building it in Hindi from English, wasn't just a case of translation. You couldn't put it in Google Translate and expect the same mental health vocabulary to travel. So it really had to be built from scratch, which is with Hindi speakers, with Hindi clinicians, with Hindi-speaking care workers. So there's the human element of it. There's the end-user element. You have to work with the community. And it's not just, again, about the language. It's also when you use technology, it's truly the UI and UX. Do the screens on the app for an English user look like the same screens for a Hindi user? And because there's so much cultural embeddedness in what you do. So yes to everything you've said. There is a huge need to personalize, because otherwise it's anyway not going to work. And we've tried and experimented and piloted like last 3-4 years, all different versions. It needs to be personalized, but I do think it's really easy to do now. The first time we built Visa in Hindi took us 12 months. The next language we did was Marathi, another regional language. That took 6 months. And now it takes 1 month for us to ship it out in a new language. And it's only going to get faster. So I'm hugely optimistic because of technology. And just another quick note is that outside of mental health care, which still remains, I think, one of the harder things to do at a personalized level, given the clinical risk and medical liabilities and stuff. In something like the education sector, for instance, in countries like India, Bangladesh, Nepal, at a national policy level, personalized education is already being rolled out in state school systems. This is fundamentally very simple. Like a third grader, everyone's put in the third grade because of their age. There are a lot of kids in third grade who are already at 6th grade level, and a lot of kids are left behind at 1st grade level. And technology can fairly easily solve for that modulation in terms of the learning level. So it's already being done in a lot of different sectors, and I think the care economy will catch up really soon.
Can I just quickly add to that? I think it's amazing as well, the work that you've done. That's unbelievable. Another thing that I would add is most of the services, when it's delivered, are council. And that council should have the data based on the demographic that they're serving to within that council. So having one streamlined version is not going to work, because in South London, for example, we have a high African Caribbean demographic, and then in another place you won't. So if you have one model, it's not going to translate anyway. So I think, to answer your question, having more autonomy at a council level with the budget and working with organizations and those specialists and collaborations and the rest of it, local businesses, people who are actually interacting with the people that it's serving on a daily, and kind of putting that power back into the schools, the organizations, the youth clubs, the drop-in clinics, whatever it may be, at a council level for that demographic. So that's one of the things I would say.
We can have one more question. Do they want to do?
Thank you so much. I think you all probably have, to some extent, answered this already. In the kind of post-war period in Europe, the welfare states were able, to some extent, address the problems of industrial society. Now it seems that this problem, mental health, the welfare state is not able to address that, and it's becoming kind of very bad. So do we have reason to be hopeful that we will be able to address this grand challenge? And what keeps you hopeful? If you highlighted one thing maybe a quick thing, that we will be able to address this. Thank you.
I'd like to respond to that. I think there's a great deal of hope, and the hope comes from one simple fact, that we're all here spending time. We obviously all care about what's going on. I'll go back to the point I made earlier, which is that geopolitics and the drive by many countries to serve their own interests at the expense of others makes this problem much greater. The post-war world, I think, just carried on, personal opinion, a process whereby control still vested where it had vested before, and most of the post-war institutions were set up to do that, including the World Bank, the IMF, etc. If we look at their record and their projects in countries, it's not great, to put it very mildly. So, but what gives me hope is the citizens of most countries. What people want are basics. They want good education, they want housing, they want transportation, they want their children looked after, they want care when it's needed, they want medical services. And I think people are pushing for that more and more. The younger generation, I don't think, is taken in, and it has less trust of our political leaders globally than we did, perhaps. So that gives me some hope. I think people are questioning more, demanding more, and pushing for more. I may be wrong in that view, but that does certainly give me hope that we will actually find many of the solutions. Plus the advances we're making, both in in the fields of genetics, in the fields of technology, in health research. The pace of change is astounding, absolutely amazing. There's a gel, by the way, that's being developed by the University of Leipzig that actually regrows cartilage. Imagine what that would do for sports people or for people with joint problems. It's not yet released, but it's on its way. One example.
Just to add, I think with the focus being the hope connected to young people, that gives us more reason to protect our young people then, doesn't it? Because if they're the people who are going to be making change, we need to make sure that this next generation isn't addicted to their phones, does know how to draw and use a pencil and a pen. And if the internet or the Wi-Fi goes down, they don't lose the plot. That they know what it's like to be bored and have a creative imagination and create something from nothing. And the next amazing inventors are going to be the young people, but I think we also owe them a duty of care and responsibility to give them a chance. And with the increase of the apps and exposure to certain things for younger people, we're doing a disservice, and that's where I do definitely agree where the government level needs to step in. And in some countries it is, with some social media bans or stricter regulations around access to things and internet and so on, and devices, and just having limitations on it in general. But yeah, definitely the kind of protection and focus and support for our young people, if they are the hope for the future.
Thank you once again. That's a very positive. That's a very positive end to what I think is just a start of a conversation. We hope to keep having such recurrent discussions about something that's so much essential, but still hasn't really found its spotlight yet. And we hope, like how all of you also have said, that governments, citizens, decision makers soon wake up to the reality that this is not something that can be pushed under the carpet anymore. And hopefully, youth power. So on that note, I'll hand it over back to Ville. Ville, any final words that you want to share?
Well, thank you so much to the panel for an absolutely fascinating discussion. We have some canopies, we have some drinks. Please stay and network. Be brave. Come up and speak to the panelists. Okay, and stay for a little while. And do look at the resources online for Fast Forward 2030. But our time is at an end today. Please join me in thanking IGP, Fast Forward 2030, Saffron, and our panel, and also you who joined our event today. Thank you so much, everyone.
Thank you.